Picture walking into like a really high-end cosmetic clinic. You know the vibe, right?
Oh, yeah. The soft ambient lighting, the
Yes.
spa music.
Exactly. You've got the soothing music playing, maybe someone hands you a complimentary cup of herbal tea, and then you get this glossy brochure that promises a really quick, simple enhancement to your intimate life.
It all feels very curated, very safe and luxurious.
Right? It feels safe.
Yeah.
But today, we're taking that glossy brochure and we're laying it right next to a stack of incredibly dense, sternly worded medical and legal documents.
Yeah, it's quite the contrast.
It really is. We're looking at strict occupational safety regulations from OSHA. We've got severe warning letters from the FDA and clinical position statements from the American College of Obstetricians and Gynecologists.
And when you put those side by side with the clinic marketing.
It's jarring. It's a fascinating and frankly jarring collision between this billion-dollar beauty industry and the actual realities of intimate female health.
Absolutely.
So the specific treatment at the center of this collision is something marketed as the G-shot, or G-spot amplification.
Right.
It's a procedure that claims to significantly boost female sexual pleasure. But we are cutting straight through the marketing today. Our mission for this deep dive is to answer one very specific question. Based on these sources, what are the actual documented risks and side effects of G-shot treatments?
And to understand those risks, we first have to look at what this procedure actually attempts to do, mechanically speaking.
Right, like what is actually happening in the room?
Exactly. So based on the clinical texts, the G-shot is a non-surgical intervention. It usually takes anywhere from, 10 to 30 minutes.
Super quick.
Very quick. A medical provider uses a needle to inject a volumizing filler directly into the anterior vaginal wall. And the goal here is to create a physical raised bump.
Like how big of a bump are we talking?
Roughly the size of a quarter in width.
Oh, wow.
Yeah. And the operating theory that they sell to the patient is that this increased physical volume makes the area more prominent, it increases friction, and thereby enhances tactile sensation during intercourse.
Okay, let's unpack this. Because the filler they are using for this is usually cross-linked hyaluronic acid.
Right.
Or sometimes like especially processed collagen.
Right.
But this is the exact same active ingredient used in facial cosmetics, isn't it? Like lip fillers and cheek plumpers.
It is the exact same stuff.
So we are talking about taking a product engineered for the face and repurposing it for a highly sensitive internal mucous membrane. I mean, that alone suggests the body is going to have a really complex physical response in the hours and days after that needle goes in.
Oh, the body's response is immediate. And it's significant. If you look across the clinical sources, and even if you dig into the fine print on the clinic websites themselves, there is a standard cascade of short-term side effects.
What kind of side effect?
Well, patients routinely experience transient erythema, which is basically localized redness as the blood vessels dilate in response to the needle trauma.
That makes sense.
Yeah. And there's also localized tenderness, minor vaginal bleeding or spotting from the puncture wounds, and a period of intense itching.
Wait, itching? Why itching?
It happens as the tissue physically stretches to accommodate this foreign gel,
Oh, gosh.
but the most prominent immediate reaction is swelling. Hyaluronic acid is specifically designed to act like a microscopic sponge. It binds to water, pulling in moisture to create volume.
Well, that sponging effect makes sense if you're like plumping up a thin lip. But injecting a water-absorbing gel into an enclosed, highly sensitive anatomical space? I mean, that seems like a recipe for spatial conflict.
It absolutely is.
Adding that much volume into a tight area has to cause physical displacement of the surrounding tissue. Does plumping this specific area cause, plumbing issues?
It causes severe displacement. And medical texts actually focus heavily on the anatomical neighborhood where this injection occurs. The target area is clinically known as the clitorethrovaginal complex.
The CUV complex.
Right, the CUV complex. It sits on the anterior wall of the vagina, just about 2 centimeters below the urethra.
2 centimeters, that's so close.
Because the urethra is in such close proximity, the combined volume of the hyaluronic acid and the body's natural inflammatory swelling creates a major documented side effect: urinary retention.
2 centimeters of clearance literally leaves zero room for error. I mean, if that filler expands even slightly more than anticipated, or if the provider injects just a fraction of a milliliter too much, it acts like a physical barricade, doesn't it?
Exactly. It compresses the urethra and it basically pinches the tube shut, which means the patient literally cannot pass urine until that initial inflammation subsides.
Which takes how long?
It can take 24 to 48 hours.
The physical mechanics of that are incredibly distressing to even think about.
Mm.
You go in for like a lunchtime cosmetic enhancement, and you end up unable to empty your bladder for 2 days.
Yeah, it's awful. And that structural compression of the urinary tract opens the door to a secondary wave of much more severe functional disruptions.
Right, because things are backing up.
Exactly. When you cannot void urine completely, the bladder becomes a reservoir of stagnant fluid. And stagnant fluid at body temperature is an ideal breeding ground for bacteria.
Which means urinary tract infections.
Severe urinary tract infections, the risk drastically increases.
And the sources also cite a risk of hematuria, right, which is blood in the urine.
Yes, they do.
That tells me the pressure isn't just blocking the flow, it's causing actual trauma. The sustained compression from the filler against the delicate lining of the urinary tract likely causes microtears, leading to internal bleeding.
That's spot on, and the trauma extends beyond the urinary tract to the vaginal tissue itself. The literature documents potential complications like persistent vaginal wetness.
Persistent wetness, like it doesn't stop.
Right, because the anterior wall of the vagina is lined with secretory glands, such as Skene's glands. Injecting a thick bolus of gel can physically obstruct the natural drainage pathways of these glands.
Oh, I see.
Or it can chemically irritate them into oversecretion. So you get this continuous, uncomfortable fluid buildup. And over the long term, there is also the risk of internal scarring.
Now, the scarring aspect is particularly troubling, given the whole goal of the procedure.
How so?
Well, the body's immune system is eventually going to recognize the hyaluronic acid as a foreign invader, right? When macrophages attack that material, they lay down fibrotic scar tissue as part of the healing process.
That's right.
Vaginal tissue is meant to be highly flexible and distensible. Scar tissue is rigid. Introducing rigid fibrotic bands into a flexible canal creates shearing forces during intimacy, which perfectly explains why the literature documents a risk of dyspareunia.
Dyspareunia, yes. The medical term for severe pain during intercourse.
Which completely defeats the entire purpose of the shot.
It really does, and the physiological contradictions of this procedure become even more apparent when you look at the neurological side effects.
Here's where it gets really interesting, because I was reading this in the sources and it sounds bizarre. Some patients report a quote-unquote constant feeling of arousal.
Yes.
Now, that might sound like a punchline in a bad comedy, but this is not the pleasurable sensation the marketing promises. This must actually be physically and mentally exhausting for the patient. It's a highly distressing, unrelenting physical signal that just never resolves into a climax.
What's fascinating here is why this happens. To understand it, we have to look at the underlying neurology. The so-called G-spot is not just an isolated button you can press.
Right.
It is a nerve-dense functional intersection where the internal roots of the clitoris, known as the crura, wrap around the vaginal canal and interact with the surrounding glandular tissue.
So looking at the anatomy of that intersection, injecting 2 or 3 cubic centimeters of thick gel directly into that nerve cluster is going to apply sustained hydrostatic pressure on those delicate pudendal nerve branches.
Exactly. It is a mechanical compression. The nerves are being physically squeezed, causing them to misfire.
So the brain is receiving this continuous, garbled sensory signal.
Yeah, because the nerves are compressed by the filler, they constantly fire action potentials up to the brain, and the brain interprets that as arousal or, in many cases, chronic pelvic pain.
Because the system is basically short-circuiting.
Precisely. The sensory system is short-circuiting because the physical architecture of the nerve bed has been unnaturally altered. For the patient, trying to go about their daily life, working, sleeping, grocery shopping, while enduring sensory static that they cannot turn off.
It's unbearable, both physically and mentally
It's
exhausting.
completely exhausting.
So we focused heavily on the mechanics of where this gel is being injected, right, and the physiological fallout. But the clinical materials reveal another whole layer of risk based on how these treatments are administered.
The clinical environment itself.
Right. Because the G-shot is frequently marketed and sold as a package deal alongside something called the O-shot, or platelet-rich plasma therapy. The clinic's logic is that the hyaluronic acid provides immediate physical volume, while the PRP promotes long-term tissue and blood vessel regeneration.
Right, and the PRP process, it involves drawing the patient's own blood.
Yeah.
They place those vials into a centrifuge, spin them at thousands of revolutions per minute to isolate the platelet-rich plasma, and then inject that plasma back into the clitoris and vaginal wall.
Which is wild.
It is. And the moment a cosmetic facility begins drawing, processing, and re-injecting human blood, the risk profile shifts from purely anatomical complications to severe environmental biohazards.
This brings the strict occupational safety regulations from OSHA directly into the conversation. Because their guidelines on bloodborne pathogens, they aren't just bureaucratic red tape. They are the frontline defense against life-altering infections.
Oh, absolutely.
OSHA explicitly warns about the transmission of pathogens like HIV and the hepatitis B virus when handling human blood. They mandate a protocol known as universal precautions, which basically requires treating every single drop of bodily fluid as if it is actively infectious.
And the environmental controls required to maintain those precautions are staggering. We are talking about rigorous sterilization of equipment, immediate and proper disposal of contaminated needles in puncture-resistant containers, and really complex environmental decontamination protocols.
Because it's not just the needle, it's the whole process.
Think about the centrifuge used to spin the blood. If a glass vial isn't perfectly sealed, or if it sustains a microfracture during the spin cycle, the machine can aerosolize the blood.
Wait, meaning it sprays into the air?
Yes, you suddenly have...
That is a terrifying reality to overlay onto the marketing of these procedures. Because I want you to consider the setting here. You look at the websites, and they are aggressively framed as quick, easy lunchtime tweaks. You walk into a beautifully decorated med spa, you pay maybe a few $1,000s, and the promise is that you'll be back at your desk by 2 o'clock.
Right.
But does the casual marketing mask the need for strict, surgical-level decontamination? A casual environment doesn't neutralize biological threats.
No, it certainly doesn't.
If a med spa is cutting corners on the downtime required to properly decontaminate their centrifuge between clients, or if their sharps disposal protocol is sloppy, the patient is the one absorbing the escalated risk of a systemic bloodborne infection.
The luxurious aesthetics of the waiting room can create a profound false sense of security. A medical procedure involving needles, highly vascularized internal tissue, and spun-down blood, it requires surgical-level sterile techniques.
It's essentially a surgery in a spa.
Yes. And if that chain of sterility breaks at any point, from the phlebotomist gloves to the needle actually penetrating the vaginal mucosa, the consequences extend far beyond a localized infection.
So zooming out from the treatment room itself, there is a massive structural disconnect between what is happening in these clinics and what the major medical and regulatory bodies actually endorse. Because these glossy brochures conspicuously omit any mention of FDA approvals.
And the reason for that is simple. The FDA has entirely refused to approve these dermal fillers for vaginal use.
Completely unapproved.
Yes. Any injection of hyaluronic acid or collagen into the vaginal wall is strictly categorized as off-label use. The FDA approved these materials to be injected into the dermis of the face. And the tissue architecture of facial skin is fundamentally different from the mucosal tissue of the vaginal canal.
Right, they aren't interchangeable.
Not at all. The mucosal lining has different vascularity, different cellular turnover rates, and entirely different immune responses. Assuming a product that is safe for a cheekbone will behave safely near the urethra, it's a massive, unregulated leap of faith.
And the FDA's stance isn't just like passive non-approval. They have actively issued public safety communications warning patients against the entire landscape of the vaginal rejuvenation industry.
Yes, they have been very clear.
Their statements cite numerous adverse event reports related to unapproved cosmetic gynecology procedures. They're talking about chronic pain, significant scarring, and recurring pain during sexual intercourse. And while some of the most severe damage, like vaginal burns, is often tied to the unregulated use of energy-based laser devices also used in these clinics, the FDA's overarching message is clear. The safety profile for these cosmetic interventions has not been established.
And the professional consensus among gynecologists aligns perfectly with the FDA's warnings. The American College of Obstetricians and Gynecologists, as well as the Royal College of Obstetricians and Gynecologists, they have both issued definitive clinical position statements classifying procedures like the G-shot as medically non-essential surgeries.
Medically non-essential.
Right. They point out a glaring lack of robust, peer-reviewed clinical trial data to support either the safety or the efficacy of injecting fillers for sexual enhancement. In the eyes of the medical establishment, vaginal rejuvenation is an aggressive marketing term, and it is entirely divorced from clinical reality.
And even if a patient navigates the physical risks like they avoid the urinary retention, the nerve compression, the potential infections, the clinical sources subtly acknowledge an underlying psychological risk.
This is a huge point.
Because if you dig deeply enough into the clinic's own fine print, they will admit that a G-shot cannot cure a low sex drive or resolve complex sexual dysfunction.
Because human sexuality and the physiological cascade required to achieve orgasm, they are not purely mechanical processes. They are profoundly multifactorial.
It's not just friction.
Exactly. The physical friction that the G-shot attempts to amplify is only one small component of a complex symphony. A symphony that requires emotional safety, hormonal balance, psychological engagement, and relational intimacy. Attempting to solve a multifaceted physiological and emotional experience by simply injecting a physical wedge of hyaluronic acid is, well, it's a fundamental misunderstanding of how the human body processes pleasure.
So what does this all mean? It means the risk of profound psychological disappointment is enormous. Imagine a patient who feels disconnected, who is perhaps experiencing a deeply distressing loss of desire or intimacy with their partner. They encounter a targeted ad promising a fast clinical fix. They spend thousands of dollars out of pocket. They endure the vulnerability of the exam, the physical pain of the injection, the anxious recovery period. And after all of that, they discover that a syringe of dermal filler cannot chemically manufacture desire. It cannot bridge a gap in emotional intimacy.
And when a patient relies on a physical intervention to solve an emotional or complex physiological issue, the failure of that intervention often turns inward.
That's heartbreaking.
It is. The patient may feel a heightened sense of inadequacy, believing that their body is irreparably broken because even an expensive, quote-unquote, medical procedure couldn't fix them. The psychological toll of unmet expectations is a heavy burden, and it is a side effect that is never listed on the clinic's pricing menu alongside the cost of the syringe.
Definitely not. So, synthesizing everything we've pulled from these sources today, the risks of the G-shot operate on multiple interconnected levels. Mechanically, the introduction of a water-absorbing gel into the tightly packed anatomy of the CUV complex creates immediate risks of urethral compression, leading to urinary retention and subsequent infections.
Right. And neurologically, the localized pressure can cause delicate nerve clusters to misfire, resulting in chronic pain or distressing constant arousal signals.
And environmentally, the handling of blood products like PRP introduces the severe risk of bloodborne pathogen transmission if the clinic's adherence to OSHA decontamination protocols falters.
Medically, it remains an unapproved, off-label procedure lacking clinical data, forcefully rejected by major gynecological associations. And psychologically, it carries the weight of false promises, treating the complex architecture of human intimacy as a simple plumbing issue to be filled and patched.
We started today by contrasting the soothing, luxurious environment of a cosmetic clinic with the harsh, empirical reality of medical warning labels. As aesthetic medicine continues to push further and further into our most intimate biology, blurring the lines between surface-level beauty treatments and profound anatomical alterations, I want to leave you with a final thought to mull over. At what point does our modern, highly capitalized quest to mechanically and physically, quote-unquote, fix our bodies actually disconnect us from the complex, emotional, and deeply human reality of pleasure? Thank you for joining us on this deep dive into the sources. We will see you next time.